everybody, and thanks for being at this webinar, Top 5 HIPAA Risks Found in Private Practices and What You Need to Know. My name is Fernando, and I am the CEO of HaonTech.com. We're an IT consulting company that provides computer maintenance and network support for private practices and small offices. Worry-Free MD is the webinar series that we put together for MGMA members, and this is the last one of the webinar series. I'm a certified HIPAA security professional, a Microsoft certified technology specialist, a Microsoft partner, and project manager and software developer that basically help small businesses with their IT solutions. Okay, so let's get started. Now, this is a 30-minute webinar, like every webinar in the series. It's high level, so it's not technical, and it's strictly for educational purposes. Now, the agenda for today is top 5 HIPAA risks found in private practices and what you need to know. Okay, so I'm going to go over a couple of things here, and I have here. The first thing I'm going to touch on is the HHS Audit and the phase 2 of the audit that's coming up in the fall. And I'm going to mention a little bit about the focus of the audit this time around, and then we're going to get into the HIPAA security risks, and then we're going to end with the Q&A. So if you have some questions, please go ahead and type them in, and we'll get to them at the very end. HHS has these audits coming up in this fall. Now, they conducted an audit, a pilot program that in which they audited several covered entities, and then they documented their findings, and now they're ready to implement it permanently. So you're going to be seeing now more often that covered entities and business associates are being audited. So this is one of the reasons why it's very important for everybody to start picking up the pace in terms of being HIPAA compliant and paying attention to this HIPAA risk that you may have right now that you may not have taken care of. The audits will be coming, and you'll be seeing them more and more in the news, and HHS is getting ready for that. So now I have a couple of slides here just mentioning that the audits, this has been known since the beginning of the year that it's coming, and so you can get more information about this online. But basically, they're going to go over a couple of things. It's a little bit more focused than what they did on the previous audits that they were doing, and basically the outcome of the previous audit, you're going to benefit now because every year they're gonna touch on different things that need to be taken care of in terms of security. Like, for example, the omnibus rule is not this time around. They're going to focus on that on the audits that are coming up. So these are the things that actually we've been talking about it in the previous webinar, so it's nothing new, but you'll be looking into that. The audit is going to happen between October this year and June of next year. And the selected entities, they're going to receive a notification for data requests in the fall. And there's an audit protocol that is made available. It's on the HHS website. I have a link to this here, and I'm going to email these links to you. However, the audit protocol that HHS has right now on their website doesn't have the updated, it's not updated for the omnibus rule. So it's lacking some of that. But it's a baseline that you can use to prepare yourself for an audit, and it's available there. So again, this is the audit protocol from HHS. Now, like I said, the focus of the audit this time around is going to be basically on security, breach, and privacy. Security, they're going to make sure, look over your risk assessments, your risk analysis, make sure you have the risk management in place, see how you're doing with your device, your media controls, the security in terms of transmitting information. In terms of breach, they're going to look into the content of your breach notification and the timeliness of the notification. So they're going to see that you have policies in place to take care of that. The privacy side, they're going to make sure that you have the proper adequate notices in place, access to records, safeguards, and training that you have to have, see if you have that in place. So that's kind of the main focus of the audit this time around. So it's good for you to take a look at that. and be on the lookout. So let's get into the risks. Now, one of the main risks that I have here is non-HIPAA compliant email, texting, and instant messaging. Okay, this is one of the topics of one of the previous webinars. And the key thing is here, the key thing is that you need to be able, for it to be HIPAA compliant, you need to be able to have access control, audit control, integrity control, transmission security, and you need to have business associate agreements. Now, I'm not going to get into too technical into this, but access control has to do more about policies and procedures that you need to have in place in terms of who has access, or who can access, or who should have access to your data, the email, stored email, archives, etc. Audit controls has to do with, for example, that if you're audited, you need to provide past records of your information. So in terms of email and messaging, you need to be able to provide emails that are older than a year, maybe older than several years. It really depends. So audit control, you typically don't have this kind of control in free email services, or maybe even if it's not free in the email solution that you have. But these are the type of controls that you need to have in place. Integrity controls have to do with making sure that the data, the emails, and the attachments, everything that is sent is not corrupt in the transmission or in the storage. Transmission security is the easiest one to address, and it has to do with encrypting your information in motion, your data in motion. This is one of the areas that the free services are getting into right now, into providing some type of encryption in transit for the email. But as you can see, that it's more than that. It involves more than that. Business associate agreement. Any cloud provider that you're using you need to have a business associate agreement signed with them. Cloud providers are considered business associates under HIPAA, so they fall under the HIPAA guidelines, and they have to be HIPAA compliant as well. So you're typically not going to have this business associate with your free email services, whether it's email, backup, etc. So that's a big risk, typically that's encountered in small practices and small offices. And texting and instant messaging is also common, not as common as email, but texting is pretty common as people start moved away from traditional pagers. They start texting, and then when you're texting information, you have to be careful with the information that's being texted. If there's a PHI in those messages, and then there's a potential for a breach there. And again, patient health, protected health information is not just a medical record number. There's more information that could be considered PHI. So texting that's not secured, et cetera, and instant messaging, those are big risks that are happening right now. Instant messaging, especially when there's free services that do these things, smaller practices tend to jump in that bandwagon and use the free services when they're actually have an issue there in terms of HIPAA and compliancy. So that's that. The next risk that I have here has to do with encryption, no encryption, and inadequate backup. Big problem here. No encryption. Encryption is not required by HIPAA, but it's definitely a best practice to use encryption, and it becomes your safe harbor in terms of breaches. If you have data that's encrypted properly and you do have a breach, or you do have loss of data, but if that data is encrypted under HHS, under the HIPAA guideline, it's not considered a breach. So it's definitely a good idea to encrypt all your data that has PHI, and typically in your typical office environment, you have all these devices that I have here in the slide. You have your servers, your desktops, your mobile devices, your smartphones, etc. Your USB drives, your tape drives for backups. All of this data that sits on these devices should be encrypted. Okay, and typically that's not the case, and it's very easily done if you can to do the encryption. But unfortunately, it's not commonly done. So if any of these devices get lost, stolen, misplaced, that's that's the problem, and that's where the data breaches, most common data breaches occur. So, and it can easily be avoided with encryption. The backups is the other big one. Typically, backups are taken for granted, and it's the type of thing that you set it and forget it for many offices, and they think that they have a backup running, or they think the EMR vendor is backing up their whole network. But it's kind of like when you have insurance, like you really want to make sure you have the proper coverage for your insurance, because in the event that that something happens, you want to make sure you're covered. With the backups, it's kind of similar. You don't want to just assume that you have the right backup set up in place, and that in the event of an emergency, you don't want to find out then that your backup is not working, or that you're not backing up everything that you need. So that's typically what happens with the backups in the small offices, is that they're not properly set up. They're not backing up the critical data. They're backing up everything at once. So it's like one big backup, and the time to recover from a big backup is hours, days, and sometimes even weeks, depending on the size of the backup. So again, it's not properly backed up. And it's not encrypted. Okay, that's the big one. USB drives being used as storage or backups. You're plugging in a USB drive to a desktop or server to store additional files just because it's easy to unplug and plug to another device. Big problem there, big risk, and I see that all the time. The tape for backup, it's an old technology. You shouldn't really be using tape for backups anymore. You should really move to a better backup solution. Typically, the tapes are not encrypted either. So again, it's a big risk that I see all the time. And also, another thing to mention about backups is using these online services like Dropbox to store files, and a lot of people think that those are backup solutions. There's a difference between file storage and backup, or a backup solution, and sometimes those terms are used interchangeably, and that just confuses things. A business continuity and backup solution is not the same as one of these file sharing services. And again, if they're free service, you're typically not going to have a business associate agreement signed. So that's your big risk there. It's not a proper backup solution to use that. I understand the conveniences, but there's a difference between what you need and the convenience of having these file sharing service. You can get both if it's properly set up. So that's in terms of encryption and inadequate backup. The next one is poor security or poor physical security or access control. Excuse me. Now here I have a slide that a picture. I think it's hilarious. It's basically an entryway to a restroom, right? And then there on the side you see a physical server or a server rack with servers. That's an example. It's not something that I just picked this picture from somewhere, but that's an example of poor physical security or access control. I've seen over and over that I walk into offices and the server is sitting or is right there on the floor, accessible to anybody that passes by, and that is a problem that you need to address. And if you are audited, that's going to come up in the audit. So again, having a server out in the open is a problem, because anybody can spill something on it, can kick it, can pull a wire, or somebody that doesn't work in the office might be in the office, a repairman or maintenance or some. These are things that you might not think about, but these are things that happen as an accident or happen once in a blue moon, and it's a risk that you need to look into. So physical security is very important. You can get high tech and then get ideally you want to have your server in a locked room or in a locked cabinet or somewhere where it's not accessible by personnel. You want to have it locked. There's devices, cabinets, closets that you can buy just to put a server and all other networking equipment. not just the server, your router, your wireless, everything related to your infrastructure should be physically protected. And also your desktop, your laptop, those need to be wired down to your desk or locked. There's a cable that you can buy to lock your laptop so nobody just picks it up and walks away. That's the example of physical security and access control. And I see that over and over. Very typical very typical problem, the physical security. Okay. So the next one I have here is portable devices and remote access. Now, very typical. People are connecting to your network from outside remotely, and what I typically see is that there's no firewalls or there's no business class firewall. There's typically small firewall appliances or routers that you get in Staples or Best Buy that are really consumer grade. That's not a business class firewall. So the security in those devices are not ideal for a business, and especially not for a medical practice. So that's a typical problem that I see. There's no VPN connectivity. VPN is a virtual private network. It's a technical term for secure connectivity, secure network between your office and another and somewhere else remotely. Unsecured or shared Wi-Fi, very common. If you do happen to have Wi-Fi, and you have to make sure that the Wi-Fi is protected, that it's not open, that it has encryption, that it's not sharing the same network than your office network. So if somebody is on your Wi-Fi, they cannot connect to one of your computers. That's a big problem that I happen to see, that an office has a shared Wi-Fi, so to provide guest access, but they can also access their computers or their printers and view files. So that's a huge problem right there, big risk. And typically that happens when the office is set up by somebody that's not really an IT expert or not necessarily well versed in network security. Again, when you're using these consumer grade devices, are typically made to be easy to use for the consumers, and there's a compromise in security when that happens. So again, if you're accessing your devices, your office remotely, you're accessing it from a Starbucks, from the airport, from a hotel, anywhere you access your network, and you're accessing it with personal devices. So the personal devices can access your network. They can introduce malware to your network if they're not properly scanned or monitored. So those are risks that you need to look into and make sure that you don't have any potential security holes there. So this is a big problem as well. And when small offices try to, it's convenient to connect to the network, and there's different services and tools out there that allow you to connect to the network. And that needs to be done securely, and that's a risk there. Okay. The next one that I have is incomplete or even no risk assessment. It's a requirement. This is the topic of one of the webinars. You need to conduct a risk assessment. Okay, and they can't just be a checklist. So you have to make sure it's comprehensive and complete. Typically, I have listed here what I see is wrong people doing self-assessments. So basically, a small practice will, instead of hiring an IT expert, a certified a HIPAA security professional, for example, to do an assessment, they opt to do the assessment themselves, a self-assessment, and you can do that. There's tools that can help you. I showed you in the previous webinar the HHS Security Risk Assessment tool that's available. So there's tools and templates available, but that comes at a risk of not doing a thorough job, and there's lack of preparation, lack of time, usually incomplete inventory. When you do a risk assessment, that's very time consuming, and you need to make sure you have well documented all your computers, all your equipment, everything in your office, your policies and procedures, and it's not just about technology, but your policies and procedures. So that has to do with documentation. Typically, there's poor documentation, and there's also the assumption that the EMR in the cloud is enough. Another topic of a previous webinar. If you have an EMR that's cloud-based, it's not enough in terms of security. You still need to look into you still need to do a risk assessment and evaluate and different areas that have to do with that EMR in the cloud. And that the risk assessment questionnaire will go through that, and you have to go in that. So it's not okay to make an assumption that just because the EMR is in the cloud, that your office is HIPAA compliant or everything is HIPAA compliant. The next one here I have is outdated or unlicensed and unsupported software. This comes up a lot, and I had a webinar in the past about that in Windows XP when it went end of support. So some offices have software that's really old, outdated, that is no longer being updated. So software that's not updated is vulnerable to security holes, to security breaches. There's a reason why they're updated, because they patch security, they fix security problems. They also add enhancements, but the more important one is about fixing security problems in the software. If they're unlicensed, that's a problem. You can't have unlicensed software. That's just a legal problem right there, and it's a HIPAA problem. Okay, a HIPAA issue. Please feel free to reach out to me. My contact information is on the screen. My name is Fernando Sosa. I'm gonna see if there's anybody who asked any questions. If you haven't asked any questions, please go ahead and type them in, and I'm gonna go ahead and check out the questions. I have a question here that says, any recommendation for encrypting USB devices? Encrypting, sure, there's many technologies for encrypting USB devices. Windows itself has encryption technology, especially the latest version of Windows, Windows 8, and it's called BitLocker. It's free. It's included in the operating system. There's other encryption software more advanced, but you can use BitLocker. It's as an encryption tool. I'm going to send you a link to more information on that. So any questions, any other questions? I'm taking a look at the queue. What about remote wipe? Yes. Okay, somebody asking you remote wipe. Okay, something about portable devices that you need to have is you need to be able to account if you lose a device. There's a functionality called remote wipe. Okay, that function is, it basically allows an administrator to remotely erase or wipe your device. So, for example, your smartphone or your tablet, if you're accessing your network with that device and you have access to your email and files, etc. If you lose your device, an administrator can go in and remotely connect to your device, wherever it is, and erase it completely or wipe it. The technical term is wipe. That's something that you need to have in place in order for any portable device that connects to your network or accesses your network. This is on top of encryption. Okay, that's a good question there. Anybody else has any other questions? My name is Fernando Sosa, and thank you very much.